this is just the beginning. That's the world that we live in. Let me help you believe in what we can do when we stand united. We are one with the world. We can make a brighter tomorrow. Together make a change. It's our life. We can't step back from what we know is right. So let's shine our light. Oh, let's shine our light. We won't listen to what they're saying. We know it's just love that we're giving to this place that we call our home. We can't change what's been done, but it's still our run. We are one with the world. We can make a brighter tomorrow. Together make a change. It's our life. We can't step back from what we know is right. So let's shine.
I am Sanjoy Roy, the co-chair of the Catalyzing Change Week Programming Committee. Welcome to Catalyzing Change Week 2024. This is where we'll not just have conversations, but we'll actually see change. We'll see change makers, innovators within the social space. You'll meet government folks and funders. You'll see people who've done excellent good practice that we can learn from. And most importantly, it'll be a place to network, learn, and exchange ideas. So do dive right in to the Catalyzing Change Week 2024 and enjoy the experience.
A warm welcome, everyone, to this wonderful third day of Catalyzing Change Week and this inspiring session lined up ahead in cities ending homelessness, cross-sector solutions. So I would just like to remind you of the housekeeping rules. So please keep your video on if possible. This allows interaction with members and the hosts. Show your name and company. We would love to know where you're tuning in from. And if you would like to speak and share your thoughts, please raise your hand and unmute. For any technical questions, you can either contact me directly, or you can also email at Zoom as support. And something that isn't going to be hard to do at this session is to enjoy. And without further ado, I'd love to pass it on to our amazing moderator, Mel.
Thank you very much, Urban, and welcome to everybody for what we consider to be a very, very important session in Catalyzing Change Week. They're all important sessions, but obviously the focus today is on homelessness, as Urban says, cross-sector solutions. So what we're going to do today is we've got a couple of speakers coming up in a moment who I'll introduce. But really we're trying to focus on what are the solutions for global homelessness. In some ways, the scale of the problems which are increasing and what the problems are articulated. But how do we solve the problem? And that's where Cities Ending Homelessness has come from. It's a collaboration between Homeless World Cup, of which I'm the president, and Catalyzing 2030. And it came about following some discussions and wanting to involve all members of Catalyst 2030 in discussions where we're looking at potential solutions. Just in terms of a bit of history and background to this, we had our first conference last year in Sacramento. Prior to that, we had a report which was launched at that conference, which had spoke to different people about what the solutions were. So the report just contained solutions to some of the problems. And the idea is that in Cities Ending Homelessness, we look at cities around the world, connect them together, and share solutions. So a number of these solutions had come from Catalyst 2030 members, from people that were doing all sorts of different practical inputs around the world, which were being effective. I think that for many of us, myself included, we understand that the world has a system failure. It's a system problem. A lot of the work that we do at the Homeless World Cup, for example, we are working with people in the 70 partners we have around the world who've experienced homelessness, and we use sport, and in our case, football, as a method of getting them back off the street, back into society. But the challenge that we face is that as soon as we do that, and we're reasonably successful at it, somebody else comes. So that it's about prevention to stop people becoming homeless. How do we create cities, countries, a world where there isn't any homelessness? I for one, like others, believe that we can create a world where there's no homelessness. There's no need for this, and you can see that the ingenuity and brains that we have around in Catalyst 2030 alone, if we were to sit down with required resources, we could actually come up with some solutions. So we're very, very driven on that solution based, and we are, apart from the sector that we're in, because obviously there are a lot of charitable organizations, academics, governments working at looking at solutions who in what we would call in the sector. I think what we're quite keen to do with this initiative is to talk to people who are maybe not from the sector, not working directly with homeless people, who maybe have a different way of looking at things, who can provide insightful or innovative solutions that might be very, very practical to deliver. At Homeless World Cup, because we move our event around the world, we are very keen on linking the cities that have previously hosted the event and will host the event to come together to think about what legacies might be, about what impact might be around our event, and to join together across the world and share those experiences. So today's session, fitting perfectly into Catalyzing Change Week, is about looking forward and looking at cross-section solutions, how we can be innovative, how we can get smart social entrepreneurs, social innovators, other people in other sectors together and build momentum around cities ending homelessness, so that we can get to a point where we genuinely believe we can end homelessness. So I'll finish there as that part of the introduction, but I'm really delighted to say that we've got two great speakers who are going to talk to you just now. The first is Professor Suzanne Fitzpatrick, who I think I would describe as a leading international expert on global homelessness. She's worked in this area for many years, done a lot of research, been involved in a lot of collaborations, and is a leading thinker in this whole area. And her whole experience of working in this sector is something she's going to share with you just in a moment. The second speaker who'll come along is Chris Underhill, who has expertise in areas of mental health, once again, like Suzanne, globally. Chris is a serial social entrepreneur. Chris and I also work collaboratively on the Elders Initiative, and so we know each other. I've got to know each other really well, and I know Suzanne as well. And so Chris is going to be talking about the issue around mental health, which is an issue which runs across all countries as an issue around in the area of homelessness. So without further ado, I'd like to hand over first to Suzanne, who's going to speak to you for 10 minutes or so about the global issues and her experience and where she thinks things might move forward constructively. Over to you, Suzanne, and very welcome to see you. Look forward to your chat. Thank you, Suzanne.
Thanks very much indeed, Mel, and it's great to be here. It's my first direct engagement with Catalyst 2030, although I've heard so much about it from Mel and colleagues at the Homeless World Cup, so I'm really excited to be part of the event today. As Mel was saying, I have done research on homelessness and related issues for many years now. A lot of the work has been obviously UK based, I'm based in the UK, but also a lot of work at a more international level as well. And what I'd like to draw upon today is a study that we've done fairly recently for the Institute of Global Homelessness, which looked at or evaluated what worked in attempts to end street homelessness in 13 cities right across the globe, in both the global south and the global north. So these cities were in Australia, Africa, India, North America, South America, and across Europe. So a really wide range of very different kinds of contexts. But one of the things, and obviously there are differences between those cities in terms of the starting point, but what we were really struck by was the level of actually similarities in what was needed to effectively respond to homelessness. So if Urban, can you share the first slide? So that's what I'd like to talk about today, is what works in ending street homelessness in cities across the world. Moving on to the first substantive slide. I want to start at the sort of systems level in terms of what our research, that particular project, but also other work that we've done, indicates that is what works at the more sort of systemic, fundamental level. And clearly it has to be acknowledged that resource-rich environments, places where there is already a lot of housing support and other welfare and other supports for people experiencing homelessness or at risk, are in a very different position to those that are resource poor settings. But resource poor settings aren't just in the global south. There are a number of the cities we looked at, for example, Little Rock in the United States, also were very resource poor as compared with, say, Glasgow and Manchester in the UK, or Adelaide and Sydney in Australia. So this does obviously make a difference, but it wasn't the only really fundamental issue driving different levels of success in addressing street homelessness. It's not just about money. Political will of the local and the national state is absolutely pivotal too. The two most successful cities that we looked at were Sydney and Manchester, where they had managed to drive down street homelessness really significantly, not eliminate it, but drive it down. And in both cases, what you had was a very high-profile political figure who'd sort of staked a reputation on it. So in Manchester, you had, of course, the Mayor Andy Burnham, and in Sydney, you had the governor, again, giving this really high political profile. Another key systemic issue that we come across over and over again is the importance of coordinated efforts. And we mean coordination here on two levels. First of all, you need the presence of a lead agency, which can be in the voluntary sector, it can be a government agency, it could potentially be in the private sector, but you do need an organisation that's taking the overall lead, so that you don't end up with a sort of very fragmented responses. Lots of different organisations, often very small, multiple, kind of struggle, disconnected, sometimes sort of struggling away, sometimes cutting across each other. It makes all the difference in the world to actually coordinate those efforts towards the goal of reducing, at least, and ideally eliminating rough sleeping or street homelessness. But another way in which coordination matters a lot is coordinated entry to the homelessness system, the sector, as Mel was calling it. Very often we leave, even if there are resources and services available, we leave people experiencing homelessness to kind of navigate those systems themselves, and they have to sort of, go to one place to try and get housing, another place to try and get support, another place to try and get food and other basic goods, another place to get access to welfare benefits if there are those entitlements. What instead we need is a coordinated entry system that wraps the system round the person rather than expecting them to navigate it for themselves. This also helps with accountability, efficiency and fairness in the allocation of resources. And we saw a big difference between the cities that had that kind of coordinated entry and the ones that didn't. Final sort of broad brush point I'd want to make was about generic versus specialised responses. The profile of people affected by homelessness is different in different parts of the world and in different cities. So in those places where you have a very strong welfare state, like in social democratic northwestern Europe, you have a relatively small homeless population, but with a high intensity of needs, because the people for whom their homelessness would be driven only by poverty don't find themselves homeless in those situations because poverty is so well managed. But in contexts like much of the global south and North America, you have a much weaker welfare state and you have a much bigger homeless population and a much more sort of mixed set of needs within that homeless population, because many people don't necessarily have sort of complex support needs. They simply are experiencing poverty, and that's enough to push them into homelessness. So you need services that reflect that diversity, rather than just being generic or assuming a kind of uniform set of needs across the homeless population, that you actually use data to understand the profile of the people that you're working with, their routes into homelessness, how to make those services well targeted and culturally sensitive, and so on. Moving on to the next slide. Getting into the nitty-gritty a little bit more now. So that was sort of the broad brush points. This is more kind of at the practice level. Here are the key ingredients of an effective response that our research would support. The first one is a really crucial one, which is assertive street outreach services. So not just street outreach services that provide food and blankets and other goods that just basically keep people alive on the streets. This is much more purposeful. It's about being assertive and having an offer to make to people, a decent, at least temporary accommodation offer, but with the those links in to offer rapid access to settled housing. But it's also partly, a lot of it's about resources, but some of it's about mindset as well. Those services have to go in with the purpose of moving people off the streets, with the mindset that street homelessness is unacceptable and it has to be reduced and eliminated, rather than simply sort of finding ways to keep people, sort of allowing people to manage on the streets. Mentioned rapid access to settled housing already. That is easier in some contexts than in others, but it's obviously absolutely critical to resolving homelessness. Some people, and I say this varies between the cities, what proportion it is, but some people who are experiencing street homelessness have more complex support needs, certainly with mental health, as Chris will talk about, sometimes substance misuse, physical health and other issues, and they might well need support to sustain that settled housing. And Housing First, as many people will probably know on the call, is a very well evidenced model for this, offering rapid access to ordinary settled housing with the wraparound support that people need to sustain that housing on an open-ended and relatively unconditional basis. And people need access to mental health, substance misuse and other services. And I know Chris will be saying more about that, but the key point I would just want to flag is the importance of those services being available without high conditionality barriers. So services which say you've got to be sober before you can use those, services that say you've got to be medicated for your mental health services, your mental health conditions before you can use them, and so on, really create very significant barriers to many people experiencing street homelessness. Moving on to the next and final slide from me. I think, as well as identifying what does work in tackling street homelessness, it's really important to stop doing what doesn't work as well. And here we have some really big challenges right across the globe, in the global north and south. And the first one, in many ways, is the most kind of obvious and practical problem that we have, which is the continuing reliance on large communal shelters in many parts of the world. I mean, this is very common in rich global north cities as well as in the global south. Shelters are undignified, they are often inhumane and unsafe, with little, if any, preventative function, and very often they fail to provide an onward route to more appropriate settled housing, although that isn't always the case, but is often the case. A focus on shelters represents a level of ambition which is limited simply to managing rather than reducing or ending street homelessness. Scotland, where I'm speaking from, I think possibly is unique in being a country where there has been a decision has been taken and implemented to end the use of shelters, communal shelters altogether, and move on to much more appropriate single unit type emergency accommodation, but the use of shelters is widespread and something that we have to collectively move away from. A weak state response, the government, both local and national, not doing enough to address homelessness is a very widespread issue, very variable. States tend to do a lot more in Europe and in the UK than elsewhere, but also in some parts of South America, you do have quite robust state responses. In many other parts of the world, you don't. And where you don't, there tends to be a very heavy dependence on faith groups for service provision. But this brings its own problems, with certain religious denominations driving high conditionality thresholds for access to services. They are uncomfortable with harm reduction type approaches. And the overt religiosity of some of these settings can be off-putting to people experiencing street homelessness. Also deeply unhelpful is the aggressive enforcement by police and city authorities, closing down encampments, moving people sleeping rough on and so on, but without offering support and a route off the streets at the same time. Historically, these kind of enforcement approaches have been particularly common in North America and in the Global South, much less so in Europe and in Australia, where at least sometimes the police can actually be helpful partners in addressing street homelessness. But where you have that aggressive forms of enforcement, then it's cruel and counterproductive, and it's really important to deal with it. It's a really good example of not everything in this space being about resources. Some of it's about ideology, politics, power, and so on. And the final point I would make is about prevention. Right across the 13 cities that we studied, including the better resource cities in the UK and Europe and Australia, there was disappointingly little targeted work taken to prevent the flow of people onto the streets, even from highly predictable pathways into street homelessness, like prison, hospital, care settings, young people leaving care. We know that all of these groups are at very, very disproportionate risk of homelessness, particularly people leaving prison. But there was seldom much, if any, work happening to try to stop that. So you're not turning off the flow of people onto the streets. Even if you're managing to help people who are on the streets, the overall levels of rough sleeping often continue to rise. So we have an overwhelming emphasis in most parts of the world on emergency interventions once people are already in crisis, rather than actually preventing them experiencing the trauma of homelessness in the first place. And I think that's a really important priority moving forward, and perhaps an area particularly where the kind of innovations that Mel was talking about could be really, really useful. I'll leave it there. Thanks, Mel.
Thanks very much. That's fabulous, Suzanne, and really gives a kind of, in a very summarized kind of way, situations that are happening around the world. So your experience and insight is vital. So thanks so much for sharing that in such a concise way, because I know both probably you and me can speak for hours and hours on this subject. So that's really great. So I appreciate that. So thank you. Now, what one of the areas that's at the beginning of this that is common, and Suzanne touched on it there a couple of times, just around issues around mental health, which manifests themselves similarly around the world. Is one area. It's obviously about housing, it's obviously about employment, etc. But we wanted to focus on one of those today, and I'm delighted that Chris Underhill has been able to join us, and he's going to talk about the issue around mental health and homelessness. So given his great experience of working in this space of mental health, it's fabulous that you're here. So over to you, Chris.
Thanks very much, Mel, and thanks, Suzanne, for laying it all out. I wanted to cover a number of different issues in this context, and so, if I may, I'll jump straight in. The whole question of mental health and homelessness is obviously complex, and it is much interrelated, I think, and that's one of the things that will come out as I go forward. There's also another thing, which is that a lot of us nowadays talk about well-being, and I think there's an important relationship between low mood or low well-being and mental ill health as such. And so some people, of course, start out with an understandable sense of low well-being as they become homeless, for example. And that then, of course, becomes actually serious mental illness as time goes on. Poor mental health can both cause and result from homelessness, I think. For instance, the onset of mental illness can lead to a series of events that force someone into homelessness. Conversely, housing insecurity and homelessness can exacerbate or cause mental health problems. So you get this causal effect, this circularity, which is not unlike the same kind of circularity which occurs for communities of people in poverty. And it's the same kind of circularity. Crisis, which is a specialist charity in the UK, notes that among people experiencing homelessness, something like 45% have been diagnosed with mental health issues. And this rate increases to 8 out of 10 for those sleeping rough. Incidentally, I've used a number of references in this talk today, and Caitlin will kindly pop these into the chat in due course. There's about 4 or 5. And if we just think about the situation across the water there, approximately 20 to 25% of the US homeless population suffer from severe mental illness. So that is SMI, severe mental illness, schizophrenia, bipolar, etc. Compared to only 6% of the general public. So I want to look now at some of the kind of major factors which precipitate some of this. First of all, economic factors. I think it's and a lot of you who work in the field of homelessness will already be aware of this, but the economic downturn caused by the pandemic has heightened the risk of homelessness for many people. Even before the pandemic, a significant proportion of the population was just one missed paycheck away from poverty. And if they were one missed paycheck away from poverty, then that cycle of vulnerability that we talked about earlier then kicks in, I think. There are, of course, coming more to the point of mental health and mental illness, there are, of course, the psychosocial factors which are important. They, in fact, are a constellation of factors, not surprising, including family breakdown, psychological deprivation, and impoverished self-esteem, contributing to the downward cycle of poverty and homelessness. So as we can see, these factors are interrelated and appear to be just as intricate and interrelated as the description that Suzanne has given us a little earlier. Many of us who think about mental illness are used to the idea of stigma, but of course we have to understand that there is a double stigma often applied to people who may have a mental health concern and who are themselves homeless. And so people on the street are often used to being stigmatized in their own right, and people with mental health concerns are used to being stigmatized in their own right. Put the two together, and you have a very powerful environment for stigmatization. I wanted to focus on a city that I know well, and the events of the Healthy London Partnership, which convened in 2021 a pan-London homeless health community of practice event. The goal was to bring together colleagues from health, housing, and the third sector to address mental health conditions among people experiencing street homelessness. The event highlighted models of service delivery and showcased examples of good practice. It also discussed challenges and gaps in the mental health provisions. So even in a wealthy country, there were many gaps. Public Health England conducted a scoping review of mental health provisions in London, mapping out the availability and accessibility of services. The review emphasized the strong association between trauma and homelessness. Organizations in London have taken steps to provide trauma-informed and co-design mental health services for homeless individuals. It was also shown that voluntary crisis services could sometimes and at times be effective in supporting unhoused individuals with mental illness crises. There were, of course, many other features to that particular work. The opiate maintenance therapy and assertiveness outreach program, opiate maintenance therapy, has been beneficial for homeless drug users with mental health issues. And the whole concept of critical time intervention, sometimes known as CTI, effective during transitional periods when people struggle to re-establish themselves in stable housing with access to support. In all, and this will be of no surprise, in all, it became clear that unless there was a multi-agency response to the mental health concerns of the street homeless, then it would not be possible to really be effective in this area. The London programme has had a number of different challenges since 2021, but I thought it was interesting that they had brought together all of those different agencies to talk about this in the context of mental health and street homelessness at that time. Collaborative approaches, trauma-informed services, and targeted interventions play a crucial role in addressing mental health challenges among this very vulnerable population. And whilst that was of course true for London, it is also true for every city. And after all, we are talking today under the rubric of cities ending homelessness. And so this challenge is, I think, just as important for a city in a low or middle income country as it is for the UK and London. One of the things I just wanted to remind you of was that access to mental health services in the US, for example, many homeless individuals with severe mental illnesses are willing to accept treatment and services. However, only 44% of adults with diagnosable mental health problems receive the needed treatment. So you've got a treatment gap, which shows itself in a number of different ways, and certainly in most countries, with the very few exceptions that Suzanne mentioned earlier. And that treatment gap, I think, is extremely important for us to understand as we get to grips with this whole question of cities ending homelessness. The combination of mental illness, substance abuse, poor physical health makes it challenging for homeless individuals to maintain employment and residential stability. And that then is axiomatic to the whole question of poverty being one paycheck away, and therefore the mental well-being, mental health issues which then relate to that. In the US, one of the important federal agencies that I wanted to draw to your attention is SAMHSA, Substance Abuse and Mental Health Services Administration, along with other federal agencies like the US Department of Housing and Urban Development, HUD, and the United States Interagency Council on Homelessness, address housing stability for individuals with serious mental illness. And so I wouldn't want to describe the US as having no resources, quite the contrary. It has resources, but when you think about it, this is the month, May is the month in which Americans all think about mental health. It is Mental Health Month in the US. And what's interesting to note is that there is no one coordinating website or body for the coordination of mental health concerns and services for the general population, let alone for specialist populations such as street homelessness. And so the very disparate nature of that large country, the US, demonstrates the difficulty in treating mental illness. So I want to just summarize now, if I may, Mel, just in the following way. Poor mental health can cause and result from homelessness. So I think that is one of the sort of key features that we need to sort of take away from this. It does require a multi-agency approach, which of course includes the not-for-profit sector as much as it includes federal and/or state agencies. And there is no question that where they have tried the idea of housing first in relation to street homeless people with serious mental illness, there have been some extremely successful examples, and I think it is obviously, although quite an expensive program in one way, it is obviously one of the ways in which this particular problem can be tackled. So, in ending there, I just wanted to say that I think this is an important collaboration that you're putting together, Mel, and I'd like to offer you any support that I can in taking forward the mental health aspects of it as you develop the collaboration more generally. Thank you.
Thank you, Chris, and just great insights again there, just given your experience and that whole point you're making about how people's mental health can deteriorate and then they become homeless, and then if you're homeless, how your mental health can deteriorate even further or become worse as a result of being homeless. And that point you made there about you know, the anxiety that all of us might have, homeless or not, about being one paycheck away from not getting any money, which increases anxiety. But if you're in a home, that would be, you know, anyone would be anxious extremely. But if you're in a homeless situation or close to that, the anxieties go through the roof. So that's a very important insight. Also, just at this point, I see there's some questions in the chat, and I'll just go on to in a minute. I'd just be really interested in Suzanne, your take on Chris's one of his key recommendations is about multi-agencies coming together to work on this. You know, I've seen recently, I'm sure you have as well, the kind of chaos that's going on in some of the Western cities in the US with people with severe drug problems on the streets and homeless. Is the answer here multi-agency task force working together, but with mental health issues kind of woven into the DNA of any strategy going forward? So perhaps if you could just kind of respond to some of the points that Chris was making, and then I'll open it up to some questions.
Thanks, Mel. Yeah, I would make 2 points in relation to that. One is, I mean, not just based on the research that I was drawing on this afternoon, the Institute of Global Homeless Research, but work I've done over the years in the UK and elsewhere, the single biggest gap is always access to mental health services. It's always a thing that people struggle with most. It seems to be a universal almost issue. So I think anything that we can do to maximise homeless people's access to mental health services is crucially important. And the points about stigma and so on that Chris raises as well can create really substantial material barriers to people accessing mental health services, even where they do exist and are otherwise well resourced. I mean, one of the things we have in the UK is quite often an approach on the part of mental health services, which is 1 or 2 or 3 strikes and you're out. In other words, if you are given an appointment for a mental health assessment or practitioner, and you fail to show up to that appointment, then you're just taken off the list completely. Now that is a very, very unhelpful, to say the least, way to work with people who might be having, you know, a lot of trauma and disruption in their lives. So I think that's a huge issue that Chris rightly flags. I think the other point I would make is absolutely at this point about coordination. I made the point in my presentation as well, but having a lead coordinating agency is absolutely critical. We certainly saw cities, you know, I'd suggest maybe Edmonton in Canada and Adelaide to some extent in Australia, very resource-rich places, an awful lot of money being spent on homelessness, lots of fancy strategies and all the rest of it, but very poor outcomes. And a lot of that was about the fact that the resources that were there just were not being coordinated appropriately and to allow you to meet the range of needs that people had. Services were kind of almost like cutting across each other and not marshalling the resources, and actually sometimes getting in each other's way. So I think the importance and who that agency is can differ in different places. Sometimes it makes sense for it to be the local authority, sometimes it makes sense for it to be a major kind of voluntary sector service provider or others. But it's really important that somebody is holding the ring, pulling all that together and ensuring that mental health services are very much part of the picture, because they are the bit that's most often missing. And the final point I would make is, certainly this is more from a UK perspective, I don't know how it is elsewhere, but one of the real challenges is that very often in the UK, it's local authority housing and homelessness services that have the key responsibility towards people who are homeless, but they have no leverage over mental health services most of the time. They have no leverage over substance misuse services. So they just are unable to bring to the table those other services that they need in order to meet the needs of the people that they're trying to help. So yeah, I would just support everything that Chris said and emphasise the importance of that coordination function at city level and at local level.
Thanks, Suzanne. Yeah, I mean, some of these things like seem so obvious, but they just don't happen. Like, surely we should all be coordinated. Let's just turn to some questions I see in the chat. So maybe there's three: one around prison, one around gender, and one around rough sleeping, which I think Miriam from Sokotaru was asking. I don't know if you just want to build on that point. This is about how do you work with people who are on the street who maybe don't want to move off the street. So Miriam, if you want to ask the question, and then we can have a little discussion about it.
Yeah, you summed it up pretty much very well. Just especially considering sometimes that some of them have some physical medical conditions that require treatments, and that adds up to the difficulty of the urgency of helping these people, and then sometimes you're just confronted with a big rejection in help. So what I've heard many different approaches, and I was just curious to know about your views.
Okay, Suzanne, do you have a view on this, kind of some best practices?
Yeah, I mean, I have quite a strong view on this, actually, and there is a lot of evidence. Certainly, this is all UK evidence that I'm drawing on, really, but that assertive type models, and I mentioned assertive outreach in my presentation, are really the way to go. What we mustn't do is say, oh, well, somebody's not engaging, so we walk away. It's up to them to take the initiative and so on. So people have got multiple problems. They've almost always suffered a lot of trauma, which impacts on their maybe initial response to offers of help and so on. But there's a lot of evidence that more assertive, what we sometimes call sticky models, as in sticking with somebody, continuing to leave the door open, continuing to offer the support, even if initially it's rejected, works really well in this space. And I've actually put in the chat a link to a research report that we've done called Hard Edges. We did a report in Scotland and in England, but the Scottish one was kind of a bit more, it was a bit deeper, it's more qualitative material in it. So I've put the link into that one, where that's really a major theme, the importance of that sticky, assertive meaning that you keep going back, you don't give up on people. And then people who have eventually managed to engage with support and come out the other side say just how important that was to them, that people didn't give up on them, and it enabled them to eventually be able to take on board kind of the help that they needed. It's not the same as forcing people, but it's just not going away easily, just keeping at it, keeping offering them it, and also, but being really clear that and I think this is particularly important in street outreach services, that you're not just there to distribute food and blankets and things to keep them alive. Your agenda is to get them off the streets, because that is not a good place for them to be. It's not a healthy place for them to be. And that's what you're about. But it's not forcing them, but it's making that offer, and making sure the offer is also backed by real resources, that you've got a decent temporary accommodation offer, not just a shelter, and you've got a route forward, ideally into more settled housing and the support that people might need to sustain that settled housing. But there is a lot of evidence about assertive outreach type models being very effective.
Yeah, just to back up on that, I mean, I think just in my experience, I mean, certainly some younger people, they were on the street and felt safer on the street, believe it or not, than they did moving into housing. So they had this big psychological barrier, if you like, even if what we would consider to be safer off options or better options, to them it wasn't the case. I'm interested, maybe Chris, you kind of from a mental health perspective, I mean, this kind of builds up, this level of anxiety builds up with people who are homeless, and maybe we need to understand where that's coming from. So in helping them, we have to empathize much more on why they might think moving into a house is actually more dangerous than sleeping in the street.
Sure, and of course, if the person in question has already got a mental health condition before going onto the street, it's quite likely that they have already learned a fair degree of mistrust through their case being handled insensitively or not well at all, let alone the family fallout and so on, which also can occur and exacerbate all of that. Good practice in the mental health space is not unlike what Suzanne's been talking about and it's not surprising. So it's about negotiating and discussing, really. And what mental health practitioners are obviously trying to avoid is any kind of force. Most countries, including the UK, do have the possibility of there being what's called a section, which is the taking of a person from the street or from the house, for that matter, and putting them into secure accommodation. But of late, and certainly over the last few decades, mental health professionals, on the whole, good ones at least, don't want to do that. That is not what they're actually aiming to do. They're aiming to negotiate treatment rather than force treatment. And I think that makes a lot of sense. There are some interesting parallels, though, in the way that Suzanne has been talking and the way that I'm also presenting the case.
Yeah. Okay, I hope that answers your point, Miriam, but it's a good, so again, it's about us sharing best practice around the world and then implementing it. Now that's what we're all about. We have a great couple of questions, very relevant. One about prisons, I'll come on to in a minute, but one from Daniela about looking at gender sensitivities and asking both Suzanne and Chris if maybe could comment on it. But Daniela, do you want to kind of build on the question you put in the chat? No, you're not coming off. You're not coming off mute. Maybe if you keep trying, maybe I'll ask Chris and Susanna maybe to answer the what you put in the chat in the meantime. But keep trying to come off mute. And so, Suzanne, do you want to kind of have a go at that one?
Yeah, I think it's the gender sensitivity point, isn't it, Daniel?
Yeah. Yes. Yeah.
Yeah, I mean, it's a really interesting point. I mean, and certainly in any parts of the world I've looked at, the majority, and sometimes the really great majority of people who are street homeless are men, single men. Certainly that's the case in the UK, and it's the case in European countries. What matters a lot is how families with children are treated. So in the US, you do have a lot of street homelessness of families with children, and I'm including there people sleeping in cars or families sleeping in cars as well. And as soon as there are children involved, the majority of those households, it will be women as well. So in countries where, like the US, as well as in the global south, where families with children are not well protected, then you will have a lot of women as well sleeping on the streets or in cars or other forms of rough sleeping of various kinds. In countries like the UK, where families with children, and most of Europe, or Western Europe at least, where you don't have sort of mass street homelessness among families with children, it is a minority, often quite a small minority, that are women that are street homeless. But of course, we know that women and men's routes into homelessness and the experiences they have do differ a lot. So the single women might well find themselves in other situations which are not on the streets, but are things that they engage in order to avoid being on the streets, which are not necessarily any safer, or at least not much safer. So Of course, we know that they can find themselves in very abusive situations and very dangerous situations in terms of relationships, just in order to either avoid the streets or to get some sort of protection while you're on the streets. And so I think that's a really big issue, is all the issues around domestic violence and homelessness. And my colleague Sarah Johnson, who's recently moved to the University of Edinburgh, has published a really powerful report that I'll also put in the chat about women and violence, or women with complex support needs who are experiencing homelessness in the UK, and the level of violence and abuse on the streets, in their childhood, in their relationships, in supported accommodation or hostels and so on, is just absolutely devastating to read. So the numbers actually on the streets might be smaller, but the experiences are even more horrific, and some of the things that people do to avoid being, or women do to avoid being on the streets, are really horrific as well. So there are definitely differences, and I do think it's something we have to be aware of as we develop policy and practice in these sorts of areas. But the household structure thing is really important, because I think sometimes we think about the sort of men and women, we think about single men and single women, and there are differences, but the extent to which homeless women have children with them is really important, and that does shape the state response. In some ways that are very positive. You know, it means that families with children are much less likely to be on the streets than elsewhere if the state takes its responsibility to children seriously. But there's also kind of there's gender differences in there are household type differences, and the kind of level of entitlements in state support really makes a fundamental difference. I mean, one final point, sorry, if I can just make it, Mel, is that one of the things that struck me over the years, not just in the recent research, but over the last sort of 20 years or so, engaging with colleagues in different parts of the world on homelessness, is in lots of ways single homelessness or single street homelessness looks quite similar across a lot of the global north, at least. Single men, high levels of mental health issues, high levels of substance abuse and so on. The thing that looks really different is family homelessness, because that's where the strength of the welfare state, the strength of the state response is really very different. So you have very, very small numbers of homeless families in a lot of countries in northwestern Europe. And the issues are generally rent arrears and very specific ones. And that looks really different in the US. So it's in family homelessness you see the biggest differences, whereas in single homelessness, there's much more sort of continuity.
Okay, thank you for that. I want to move on to the question around prisons in the chat. Then I'll come back onto cross in a minute around the prisons. But if anybody else has a question, because I'm just aware of the time, either bung it in the chat or raise a hand. But Andrea is asking a question about the point I think you made around prevention, Suzanne, about you know, people are leaving prisons and huge percentage of them end up being homeless. So and that's in the power of government to control some of that prison release. So Andrea, do you want to add more to the question you've already put in the chat?
Thank you, Mel. Yeah, I think Suzanne's answered on her chat reply really helpfully, something I'm going to think about. But I just felt that it seems that, you know, this is a group of people who the services that could be there really have the opportunity to do that, and to really do something so that people can't come out of prison homeless. You know, it just seems that they have every opportunity with a group of people. It doesn't make sense to me that group of people are so vulnerable, and they must be incredibly vulnerable once they've been in prison. So it was just a group of people. Well, just very quickly, I would love to know how we're going to grow a new generation of people, how we speak to children about homelessness because they see in cities. How do we grow a generation of people who are much more sympathetic and much more empathetic and much more determined to see the end of homelessness in cities? So those were my two comments.
Oh, that's it. That second one's a good question. First one's a good question, but the second one's a really good question. Maybe we can finish on that in a minute. But just on the prisons, I mean, yeah, it's often said in the area I've been working at, in a sense, you've captured people in prison. They're not going anywhere. Okay, so therefore, there's an opportunity around a release program that something could be done to kind of connect and maybe connect mental health services. I'll ask you about this in a minute, Chris. But the prison people I would speak to say it's easier to do with long-term prisoners, okay, who maybe had done something more with longer sentences. But the issue is around the people that we maybe work with on the street who are living chaotic lives. So they're ending up going into prison in very short prison sentences for misdemeanors, basically. Then they're coming back out again, getting into the same chaos and ending back in prison. And it's almost like there needs to be some kind of intervention in there. And of course, prison governors that I've spoken to will talk about so many people shouldn't be there because they've got mental health issues. It's not the crimes they're committing, it's the mental health. So Chris, I don't know, I'm just acutely aware of the time around it, just very quickly on prisons. Once again, mental health intervention around prison release, potential solutions, coordination again is another word we keep coming up with here.
Sure. I mean, I think it's fairly common knowledge now that prisoners are much more likely to sustain a mental illness than the folk in the general population. So that straight away is there. And these mental illnesses can obviously be depression. That's the majority of the cases, but in many cases it can also be triggering to more serious mental illnesses than depression even. So that's the first point. Second point is when they come out of prison, people with a mental health problem find it very hard indeed to be reaccommodated. So you get that drive downwards, which is so significant, I think.
Well, and a sort of double stigma.
Yeah, but also you also get, which is the same point I think was been made earlier, just about people who find it difficult to live in a house. So actually they'll say they'd much rather be in prison than on the street. So they almost kind of do something else so they get back in prison because actually there's some kind of routine there. So that's another whole hour-long discussion, okay, in the prisons. I'm just really acutely aware of the time. But I just on that second question you asked, which is a good one. Maybe Suzanne and Chris, we could just finish up there very quickly then. So I've often said, when I'm speaking to people, particularly in the West Coast of the US, that they've been brought up and they're just used to seeing homeless people on the street, so they're just there. So that's just it. They're just there. And I'm going, no, they don't need to be there. We're trying to end homelessness. So in the world, our children have been brought up now with seeing people on the street. So how do we change the view? Andrea's question. So who wants to go first? Susanna, Chris, you've got about 30 seconds each to answer, to sort that one out. Who wants to go first? Maybe Chris, you go first.
Yeah, I'd be happy to do that. I think what we have to remember is that mental health is not a vertical, it's a horizontal. In other words, the mental health affects us right across all the different domains in which we happen to live or be, and so on. And so it's really important to understand that mental health and mental ill health from time to time will affect us in wherever we are. So if it happens to be that we want to try and really remove the problem, eradicate the problem, not the people, problem of street mental health, of street homelessness, then we have to deal with the mental health consequences of that as much as we have to deal with a lot of other things. So it's going to have to be a really, really multi-agency task, and it's going to have to be one which society itself takes part in.
And what would you say to the children? What are we saying to our children about homelessness? It shouldn't exist?
Yes, I think so. Delicate and sensitive explaining, of course, so as not to frighten the children. That's really important. And then, okay. And then go from there.
Right, Suzanne, very quickly then, particularly in this point about our future, which is the children. How are we explaining what people on the street to our children?
I mean, I suppose what I would say is it's not just the children of the wider public. We actually have to convince the sector to end homelessness. I think what we've had for decades is a kind of complacency, not just in the UK, or even not especially in the UK, but across the world, where there's an emphasis on managing homelessness. Will always be with us, the sort of point you're making, Mel. So I think actually, in a way, we have to start with ourselves, those of us that work in the field, to increase that ambition, to say it's not acceptable and it's not necessary. And here's the ways we can do it. So we have to sort of start getting our own house in order, I think, which isn't to say we shouldn't try and influence, new generations and the wider public. I think there is some really good work done by the Frameworks Institute that Crisis, the UK homelessness charity, funded them to do about how do we convey messages about homelessness to the wider public, not to children in particular, I have to say, but to the wider public in ways which we tap into that underlying empathy, which does exist. I'm very optimistic about that, but it is about how we frame those messages so that we emphasise that it isn't always with us. People don't feel despondent, despair, there's nothing can be done, and actually do have the confidence that we can end it, because we can. It's political choice not to.
Well, absolutely, that's the ambition we share. This is what this is all about. This is where we came into this, kind of fed up with having success in terms of some of the work we're doing, but then being, people being replaced by other people that are coming in the street the following day, kind of thing. So yeah, I totally agree. I think we all agree there shouldn't be any homelessness in the world. So right, how do we end it? On that note, I'm afraid this hour has flown by. Thank you very much to both Suzanne and Chris for their fantastic insights and presentations and discussion. Thank you for your questions. If you want to kind of stay, if you're not a member of Catalyst 2030, please do. There's lots going on this week. But join Catalyst 2030. It's a fantastic organization to be involved in. Lots of stimulating, positive things going on. And then Cities Ending Homelessness, we're really, really keen for people to get involved with us from whatever background you're in, and concentrate on solutions with that overall aim that Suzanne has just said of ending global homelessness altogether. So thank you again. There's lots of links in the chat, way to connect, Urban, Caitlin, etc. So I hope you're able to get hold of those links. And please stay in touch. And thank you all again for joining. And thank you again to our speakers and to the fantastic Urban, who's facilitated this discussion on his birthday. Thank you very much.
Thanks, Mel. Thanks, Urban. Bye.
Thank you.
Thanks, everybody.
Thanks, Al. Happy birthday, Urban.